Have you had an itch lately, one that just won't go away? Maybe it's on your lower leg, your back, or even your scalp. You've tried everything, lotions, creams, even changing your detergent. But the itch is still there. It might seem like nothing. But what if I told you? That itch could be your body's first whisper that something is seriously wrong? Hi, I'm Dr. Charles Chuck Miller. I'm 88 years old, and I've been a practicing oncologist for over 50 years. And after all that time, let me tell you something I've learned the hard way. Some itches aren't about your skin. They're about your life. Engagement CTA. If you're over 60, please don't brush this off as just aging. I've seen too many patients, men and women, ignore the signs. I'm still seeing patients every Tuesday and Thursday, and I've made it my mission to share what I've learned. So today, I'm going to walk you through 6 specific areas where persistent itching might point to cancer. How to check yourself at home. And what you need to do if that itch won't quit. If you're watching right now, take a second to subscribe, like, and comment below if you've ever had a strange, stubborn itch. That way, more people, especially our senior community, can see this life-saving information. And please, share this video with someone you care about. It could save their life. Let's get started. Section 1, the lower leg. First up, the lower leg. Especially the front part of the shin. If you're constantly itchy there, and nothing seems to help, this could be a red flag for lymphoma. Last winter, a 75-year-old man named Mr. Johnson came to my clinic. He told me, "Doc, every night around 3 a.m., my lower legs itch like crazy. I can't sleep." He tried lotions, warm compresses, massages, even compression socks. His wife bought him the fancy moisturizers. Nothing worked. Now at first, I thought it might be dry skin or poor circulation. But he said something that made me pause. "Doc, my skin looks completely normal, so why does it itch so bad?" That's when I ordered blood tests. And the results? Early stage lymphoma. Thankfully, we caught it in time. Today, he's healthy and thriving. Here's how to check yourself at home. Try using anti-itch creams 2 to 3 times a day for 1 week. If nothing changes, or it gets worse at night when you lie down, that's a red flag. Lymphoma-related itching doesn't respond to creams or antihistamines. That's because it's internal, not a skin problem. If the itch has lasted more than 3 weeks, and no cream helps, talk to your doctor. Ask for a blood test. Early-stage lymphoma has a treatment success rate of 90%. But only if it's caught early. Section 2, the middle back. Next, let's talk about an itch in the middle of your back. This can be a warning sign of pancreatic cancer. Why? Because the pancreas is connected to nerves in your back. When it's inflamed or under attack, those nerves send itchy signals. This happened to one of my patients, Ms. Williams, 68. She'd done everything to stop the itch on her mid-back. New mattress, new pillows, deep cleaned the house, allergy tests, nothing helped. "Doctor, we even replaced the couch," she told me. "But I still have this one itchy spot on my back every night after dinner." That's another clue. Itchiness that worsens after meals, especially greasy ones, points to pancreatic issues. Self-check at home. Press the itchy spot gently. If it feels heavy, or off, it could be nerve-related. Pay attention if it happens regularly after eating. If digestive problems show up with it, like bloating or discomfort, you need to be checked. Too many people assume it's a pulled muscle or a back issue. But if there's no visible skin problem, and the itch keeps coming back, it might be something deeper. Section 3, the scalp. Third, the scalp. Especially behind the ears and neck. This is where we often see early signs of leukemia. Why? Because excess white blood cells release inflammatory signals that irritate your scalp nerves. One of my patients, Mr. Harris, 73, actually kept a journal. "Doctor, I wrote down every time it got worse. I changed shampoos. I used soap bars. I skipped conditioner. I even started washing my hair every other day, but the itching didn't stop." The strange thing? There was no dandruff. No redness. Just an overwhelming urge to scratch, especially at night. Home check. Feel your scalp for warmer than usual spots. Nighttime itching without visible irritation is a strong signal. Pay attention to other signs too, like bruising easily, fatigue, or bleeding gums. Leukemia can sneak up silently. But persistent scalp itching, especially behind the ears, shouldn't be ignored. Section 4, Around the chest. Now let's talk about the chest area. Itchy skin around your bra line, or on one side of your chest, could be an early sign of inflammatory breast cancer, even in men. Ms. Davis, 69, told me, "Doctor, I thought it was my bra. I tried cotton, silk, even bamboo. I even stopped wearing one. But the itching stayed. Always on the right breast. When we looked closer, her skin was red, slightly swollen, and the texture had changed. Here's what to look for. Uneven breast texture. Swelling or color change on one side. Skin that looks like orange peel. Itching that won't go away. For men, this is also crucial. 1% of breast cancer cases are male. So if you're a man over 60 and have itchiness or changes around the nipple, get it checked. Inflammatory breast cancer doesn't always come with a lump, which makes it harder to catch. But with early diagnosis, treatment is highly effective. Next, let's talk about a topic that some folks find uncomfortable: itching around the anus or reproductive organs. If you've had hemorrhoids for years, like Mr. Ryan, 76 years old, you might think, "Oh, I know this. I've had this before. It's just flaring up again." But this time, it was different. Mr. Ryan told me, "Doctor, I've lived with hemorrhoids for 30 years. They usually hurt when I sit or go to the bathroom. But now it just itches all the time, even when I'm not moving." He tried everything: more cream, 3 warm baths a day, even surgery. But the itching didn't stop. That's when I told him, we need to dig deeper. Cancer of the anus or vulva can cause localized, persistent itching. It's caused by tumors pressing on surrounding tissues, which stimulate the nerves and cause needle-like stinging sensations. Here's how to tell the difference. Location: cancer-related itching is focused on a specific, pinpointed spot, not the whole area. Pattern: hemorrhoid itching usually improves with creams or baths. But if it gets worse over time, especially at night, it may be something more serious. Symptoms: watch for bleeding during bowel movements, changes in stool, urinary discomfort, or unusual discharge. If treatments don't work, and the itching just keeps coming back, it's time to stop guessing. Please, don't let embarrassment stop you. Early diagnosis could save your life. Section 6, The hands and feet. Finally, itching in the palms and soles of your feet. This can be one of the strangest and most overlooked signs of cancer. One patient, Mr. Allen, age 70, came to me with a peculiar complaint. "Only the palms of my hands itch, nowhere else. I wear gloves to wash dishes, I use mild soap, I even moisturize 5 to 6 times a day." He did everything right. Cool water, cotton gloves at night, gentle cleansers, nothing helped. But there were no visible skin issues. The backs of his hands were fine. In cases like this, toxins from cancer cells travel through the bloodstream and irritate peripheral nerves in the fingers and toes. Here's what to check. Look at your palms and soles. Is the skin slightly yellow? Do the lines appear deeper than usual? Is the itching worse at night, but better during the day? Does moisturizing provide no relief? If the itching is in both hands and feet, lasts more than 3 weeks, and is resistant to creams, this could be a sign of internal cancer. Many older adults mistake this for poor circulation, diabetes, or just aging. But if the fingertips are constantly itchy without a clear skin issue, please get checked. Self-diagnosis, the 5-step at-home checklist. Let me share 5 simple self-diagnostic steps you can use tonight to help protect yourself. 1. The 3-week test. If itching lasts more than 3 weeks, it's not normal. Mark your calendar and track it. If it persists, get checked. 2. Lotion response test. Use moisturizing lotion or anti-itch cream 2 to 3 times a day for a week. If there's no change, or if it gets worse, it may not be a skin issue. 3. Check for side symptoms. Are you losing weight unexpectedly, 5 to 10 pounds in a month? Feeling unusually tired? Running low-grade fevers? These are all red flags. 4. Itch pattern log. Is the itch worse at night? Does it stay in the same spot for days or weeks? Cancer-related itching is persistent and doesn't move around. 5. Family history review. If your parents or siblings had cancer, your risk is 2 to 3 times higher, especially if it's the same type. Make checkups a regular habit. Summary and closing message. Let's quickly recap the 6 danger zones. Lower legs, possible lymphoma. Middle of the back, pancreatic cancer warning. Scalp and behind the ears, early sign of leukemia. Chest, including for men, inflammatory breast cancer. Anus or genital area, anus or vulva cancer. Palms and soles, internal cancers affecting peripheral nerves. Remember, if the itching lasts more than 3 weeks, if lotions don't help, if it worsens at night, and especially if you have a family history, don't wait. I'm 88 years old, and I'm still seeing patients because I believe one thing. Early signs save lives. Catching cancer early makes all the difference. So here's what you can do tonight. Check your body for any persistent itching. Notice when it's worst and how long it's been happening. Mark it down. And if anything I've said sounds familiar, go see your doctor. Describe your symptoms clearly, including when they started and what makes them worse. Money and fame don't matter if you don't have your health. Let this video be your wake-up call. If you found this helpful, please like, subscribe, and turn on the notification bell. That way, you'll be the first to know when I share the next video about the hidden warning signs behind common aging symptoms, like joint pain, digestion issues, and persistent headaches. And please, share this with someone you love. If you start taking action now, just imagine how much healthier and stronger you could be this time next year. Stay safe, stay strong, and stay alert.